might as well get started. Courtney, you all good if we get...
Yeah, let's get cracking.
Yeah. Okay. Hello, welcome everyone to our webinar today. We've got a bit of a Ask Me Anything session we're running for Project Mobilise. So just quick introductions. So my name's Taylor, for anyone that hasn't met me before. I head of product and growth at Beyond the Clinic, and I'm joined by Courtney.
Hi guys, thanks for being on again today. Yeah, I met a few of you last week, but my name's Courtney, COO and Director of Clinical Programs here at Beyond the Clinic.
Thanks, Court. So look, a couple of weeks ago, we ran a webinar where we gave a bit of an overview of the Project Mobilise 6-month pilot that we're about to launch in the coming months. What we wanted to do today was essentially, we'll do a quick recap, but we want to dive into the detail and explore some of the questions we've been getting. We've actually been getting a lot of interest and had quite a few meetings over the last couple of weeks from anywhere from hospitals to clinics, GP clinics, to industry partners, insurance funds, et cetera, So we thought we'd just take some of those key questions and discussion points and walk them through today in a little bit more detail. So let's just jump right in. I'm going to whiz through these slides and then we'll leave plenty of opportunity for Courtney and I to work through the questions at the end. If you have any, please do just pop them in the chat as well as we go. So who is Beyond the Clinic? We are a clinician-led team. So our two co-founders have got significant experience and expertise, particularly in the MSK space. We are backed by evidence in everything that we do, and we've got quite the track record of delivering programs in market. And we're really focused on scalability when it comes to value-based healthcare and value-based programs that we offer as well. And I'll sort of unpack what that means shortly. Now, I'm sure everyone here can attest the old bricks and mortar healthcare model does come with its own challenges and limitations. Digital health sits in I guess, a prime spot to be able to support and help. And that's where we bring what we call a hybrid model of care to the market. So while we are technology enabled, we are essentially a technology company, we are still human led. So we do have, for example, a team of physiotherapists that are health coaches for our patients, and they're there to oversee and guide patients, to raise risk alerts where needed, assign exercise prescriptions, just as an example. But essentially, it's that human touch that we feel is still so important, even when someone is doing a program from home. We've seen significant impact over 6 weeks, so that's why this pilot is very much targeted at a 6-week period. And our goal really is to empower self-management for patients, right? So how do they achieve their own personal goals? And that's where the health coaching is such a critical piece of the puzzle. And our early intervention approach has seen some pretty significant economic impact as well. And that's why we have quite the interest and a lot of discussions for Project Mobilise at the moment are sort of spread anywhere from early intervention in the preventative space. So for example, if someone's just been diagnosed with osteoarthritis of the knee, right through to someone's on a surgical wait list, or they've been booked in, and now we're in that sort of acute surgery prep phase where we need to prepare them for the best outcome possible. Courtney, anything you want to add to that?
Yeah, probably just that confidence piece there. So reporting 100% improved confidence. And I think that really comes from our hybrid model of care and giving patients the tools to self-manage, but also backing that with the support of a health coach, knowing that they can message somebody, they can jump on a telehealth, and that there is somebody there to support them. So in terms of confidence, that clinical relationship within our team is really important. And our patients have, some of them have gone from walking, 500 steps a day to that real behavioural change of up to 2,000, which you can imagine the physiological impacts of that for somebody in terms of comorbidities. So that real behavioural change in that 6 weeks period is really down to that confidence to self-manage.
So when it comes to Project Mobilise, we've put the call out to industry, whether it's hospitals, insurers, clinics, industry bodies, etc. And we do look at it in sort of this view, right? So this diagram just helps provide a bit of a visual around how we can better tailor that value-based care depending on where someone is on their journey. And we have quite a few Australians with osteoarthritis, and then right through to how do we manage and when it comes to surgery, wait lists, treatment, and then ultimately the surgery itself. So, you know, at the end of the day, it really is about how we can manage the progression of the disease, but also the healthcare costs. And we'll probably tap into that a little bit more as we go. How do we do it? So,
yeah, Taylor, just around osteoarthritis, it can be anyone with joint pain as well. It doesn't have to be a definitive diagnosis of osteoarthritis. So obviously we've used the statistics there of OA within the community, but yeah, we're looking at anyone with that joint and muscle pain.
and that probably leads into what this first step entails. So we've taken all our experience and expertise with how we clinically assess someone up front, and then we've turned that into a really quick and easy use tool that essentially provides a risk profile for a patient. So depending if they've just got joint pain right through to wherever they are on that journey, we've got a starting point where we can basically risk profile that particular person. It's then automatically triaging them into the right program. So depending on that risk profile, what is the right program for them? Again, optimizing for value-based care. And then what our technology offers as well is some optional health coaching as well. So yes, while we talk about this pilot being fully funded, the technology is fully funded. We still have a team of health coaches there prescribing exercises and have access to chat with participants. But then we have this extra layer of offering telehealth consultations with physiotherapists as well. And that's a complete no obligation pay as you go model on a per patient basis. So how does it work? Went a bit too far. How does it work? So step one is we get their joint health score, essentially. We refer them straight into an app. They download an app. They've got access to the program. So they'll run through a range of assessments, exercises. They'll touch base with their health coach. But really, it's that personalized exercise plan that's going to make a big difference for them over the 6 weeks. We do a lot of monitoring as well. So there are vital sign monitoring tools within the technology. And ultimately, what we're pulling together is a complete picture of this person. And we're able to generate a report that can be sent back to a doctor or, you know, whoever the industry partner is that we're working with as well. So let's get to the nitty gritty. So what does it look like to actually partner and collaborate together? I think there's probably 3 big questions that have come out of a lot of our discussions over the last couple of weeks worth sort of diving into. So the first one to ask yourself is, what is your point of entry? So, you know, I've rattled through, we have a range of different organizations that we've been speaking to. That could be a hospital, it could be a GP clinic, it could be an insurance fund, for example. But what is the point of entry for participants to come into that? Did you have some suggestions or ideas on that, Courtney?
Yeah, some avenues that we've been looking at for some of the partners already is just a direct to member email. So once we do that discovery with you, we can identify the best way to contact your cohort of patients, and we'll give you that welcome pack, which will have your unique link for the technology, and we can either use email or SMS. So some people that translates really well through email, through an email blast, or other people using their own internal SMS platform to reach members.
Yep. And providing you with a unique link and a welcome pack will go a long way for you to be able to tailor that entry point as well. The next question is, will you be ready to go come June 1? We are running the pilot from June through to November, so a 6-month period. It is a 6-week plan per patient, so there will be a cutoff point, obviously in October, where we need to stop referrals into the pilot in order to be able to meet our timeline. Obviously, we're funding this pilot, so we've allocated resources for that time period. So we really do ask that all partners come on board and they're ready to go from day dot. What we do in terms of collaboration is we have monthly check-ins. So if you can assign a key project champion internally, we can check in regularly, and then ultimately we're pulling together a report for you as well, which is probably the third big question that I wanted to touch on as well, is what would you measure? So what are you looking to learn, I guess, from this pilot? And that might have some sort of direct impact on the health economics of your organization, or the actual outcomes of the patient cohort. So really understanding what it is that you're looking to measure. I mean, this is what we will include in our reports. We do capture a profile of the patient, their participation, engagement, functional outcomes. We have a range of clinical assessments and range of motion outcomes that uses vision-based technology that is tracked throughout use of our application. We also record satisfaction, qualitative feedback, any telehealth consultations with physios. There are clinical summaries that come from that. And then obviously wrapping all of that up with some key learnings and opportunities that we see for each partner as well. So I think it's just an important one to make sure that we're aligned when we talk about what we want to measure. And then I think just some key discussion points, and then we can rip into any Q&As that you want to pop into the chat. So we've got, as a webinar, the Q&A chat box, or the general chat box in Zoom here. You can pop your questions in there and we'll get to those. But just before we do that, again, just sort of looking at what does partnership look like in this 6-month pilot. So being able to identify your point of entry is really key. And Courtney gave some examples there. It might be a direct email to a membership base. It might be a clinic doing a manual referral for a specific patient, or part of a surgical workflow. I guess the point of the story there is, if we can identify that point of entry, we can have a deeper discovery chat with you to understand how we execute on that. And there might be some sort of implementation we need to consider, but let's go through that conversation together. The next one there is understanding your resource allocation. So really just one person internally that we can connect with once a month to check in and make sure things are moving in the right direction. And then also how many patients you expect to enroll in the 6-month pilot as well. I believe we have a minimum of 100 patients. Is that right, Court?
Yeah, that's correct. So looking at your patient cohort, just ensuring that you have that volume, and that definitely isn't a defining number. If you want to supply 5,000, that's also doable as well.
Yep. Understanding the priority metrics that matter to you. So again, what key outcomes are you looking to monitor and learn, and what ultimately would a long-term solution with a digital health solution look like for you? So putting your sort of thinking hat on when it comes to the metrics that matter when it comes to digital health long-term. And then committing to timelines. So like we said, we're funding this pilot for 6 months from June until November. So can decision-making be aligned to towards our timelines, and also can we start referring participants from June 1st? It's another key point there. That QR code, you're welcome to scan that. That will just take you through to our Project Mobilise website. It's got a number of the FAQ responses already stored in there as well, and if any come up today, we'll add them as well. Essentially, it takes 2 minutes to pop in an EOI, so it's a simple form. So if you've still got questions after today that sort of hanging around, feel free to just drop an EOI in that form anyway. We'll reach out, we'll book some time with you, and we'll have a discovery session just to determine how we might be able to partner together. There is no obligation, obviously, with an EOI. It is simply a touch point for us to start that conversation. Anything, Courtney, you wanted to add before we look at some of those questions?
Just the opportunity for partners with this priority metric. We understand we're deep domain experts in terms of public and private health and healthcare delivery in Australia, but also globally. So we understand how hard it is to get business cases across, and this opportunity to pilot a digital health solution within your company is a great opportunity to really bring those metrics into a business case to then obviously move forward with a digital solution within your company. So really defining what would tick those boxes in terms of a metric. Some examples, it doesn't have to be clinical. Obviously, we've got a lot of clinical parameters there and metrics that can be accessed, but also just looking at demographics as well in terms of regional reach of patients. So we know healthcare is not overly accessible throughout Australia with our large distances. So how are you reaching those patients, and where are they coming from as well? So it's a really great opportunity to start with a pilot, build that business case, and then further that discussion.
Great. Cord, are you okay if I throw some questions your way?
Yeah, absolutely.
Just have a conversation about that.
Yep.
So this is one that came up in our last webinar chat, and I know it's popped up in some conversations since. I think it's worth calling out as well. Is how do we work in with the TGA regulatory landscape?
Yeah, absolutely. And this is obviously really important in this ever-evolving digital health landscape. But at the moment, we're exempt as software as a medical device, as a clinical device support tool, so under the TGA law. So that means that we've got clinicians still doing our clinical decision making. They're APRA trained physiotherapists in that role, and the technology is a data source that obviously they're looking at, but the decision making is coming from clinicians. Saying that though, we've got a robust regulatory roadmap and strategy within Beyond the Clinic that we are working towards, and working with our organisation to pursue TGA and software as a medical device as our technology evolves.
Perfect. Thanks, Courtney. Question here that's popped up in the chat as well. So there's an arthritis group looking to support people with knee OA to intervene early, but these people can't afford physiotherapy, or they've used all of their EPC items. So would a not-for-profit like this be able to be involved?
Yeah, absolutely. And being able to do a pilot with a not-for-profit organisation is a great opportunity that we see with Beyond the Clinic. So obviously, as we evolve, there is a cost with the technology and the physiotherapist services, but to start with just the app and the technology with the 6-week pilot, there would be no cost to the not-for-profit. So this is a great opportunity, and then we could look at grants and other support systems to enable a more commercial model after that.
Yeah, and sorry, Courtney, can you just elaborate a little bit more on the telehealth and the health coaching and how the costs associated with that work?
Yeah, that's right. So we're able to charge the rebate code of a telehealth physiotherapist service. So obviously that is a cost to the patient, and then they hopefully are able to either have a private health insurance rebate or an EPC rebate as well. This question obviously states that for people that aren't able to do that upfront cost, they are still able to have the 6-week program. And when we talk about that hybrid model of care, they'll still get the support from the physiotherapist. They just wouldn't have the additional telehealth services.
Perfect. Thank you. Okay, sorry, next one. So this probably similar to TGA, another compliance-based question. If particularly when we talk about the entry point of participants coming into the program and how we navigate that, but also from a technology perspective, what do we do with patient data? How do we manage and keep patient data secure?
Yeah, absolutely. So obviously this is extremely important. And so our data is encrypted both in transit and at rest. So, and we're using this, the standard encryption protocols. So as a company, Beyond the Clinic is under the security framework of our ISO compliance, and that has regulatory requirements and audits once a year. In terms of personal information, we have our privacy policy, which aligns with the Australian law. And in terms of any discussions with beyond the clinic between partners, that those confidential agreements will come into place as well.
Great. And then another question we've had, is the pilot suitable for organisations outside of Australia?
Yeah, it is. So our technology is built so it can be used. At the moment, it is English-based education and app language at the moment. So, but we're looking to ensure that, you know, in time we can expand that. Just to be aware there that all the data is stored in Australia. So obviously that conversation will have to come in terms of data storage and your own company regulations in terms of data storage. So, yeah.
Yeah, great. Another question that's popped up here, is the program similar to the GLAD program in its structure?
So similar, but not similar. So obviously, yeah, we're well aware of the GLAD program and how that supports patients. Our program, in terms of clinically validated technology, is that we've built this technology on top of the CARHAS program, which is a bricks and mortar program where our co-founder and orthopedic surgeon, Jason Sung, took, you know, patients that were sitting on surgical wait lists and essentially gave them 8 weeks of nutrition, exercise and education, and was able to get about 10% of people off that wait list. So we've essentially digitized that. What we're able to do is remotely monitor people without wearables. So our app, that's all the patient needs, and we try and educate patients to say if they can FaceTime grandkids and send a text message, they're able to use our app. So no wearables and no hardware is involved, and through the physiotherapy exercises, that's using pose tracking monitoring and able to give our physiotherapists real-time feedback. So we know kind of the bricks and mortar and the, you know, PDF copies of physiotherapy exercises that we've all got and left in the back of the car. This way, there's no cheating. So if you've been allocated 10 reps of your squats and you only do 5, our technology and our health coaches will prompt and say, hey, Taylor, what's going on today? I can see the last 3 days you've only managed 5 of those squats. And you come back with, it might be pain, it might be some other issues. So that real-time monitoring and feedback is a big difference with our technology. We're also integrating vital signs monitoring of blood pressure and heart rate just through Vision, which uses trans-optical imaging, which is an amazing resource and means that we can closely monitor patients as well. So then teamed with all that is our huge education profile as well. So when we're talking about the confidence and that self-empowerment for patients, it's that education piece and allowing them to self-monitor. So, but in terms of clinicians referring onto it, it would be similar to referring onto a program out like GLAD or some of the other ones so that patients can self-manage. But in terms of their hardware or technology or wearables, ours is no wearables, no hardware.
Thanks, Courtney. If there's any other questions, feel free to drop them in. Otherwise, there's another one I wanted to bring up that's come out of quite a lot of conversations in the last 2 weeks too. You know, we talk about early intervention, we talk about preventative programs, but we've had a fair amount of interest in the surgical space, Courtney. So can you elaborate a little bit more on how we can support patients that may already be booked in for surgery?
Yeah, that's right. And that's been some huge changes that we've seen for patients in that surgical cohort. So as we know, we've got a lot of patients in Australia in our public and private systems sitting on wait lists. And essentially, it's an opportunity to optimize these patients. And data shows that if patients are optimized, our post-surgical outcomes are better. And a lot of that has to do with confidence and education. Yes, function and mobility and nutrition and, you know, lowering BMI, they're all great markers of statistics. But if somebody is educated and well engaged, their outcomes are going to improve a lot. So that patient cohort, a lot of it is getting them used to what type of exercises they'll have to do in rehab, but also getting them moving. So yes, they're in pain. Yes, they're booked in the system for a knee or a hip replacement, but having that that support to keep moving, and that ongoing encouragement of goal setting as well every week in the lead up to their surgery. And then just simple things that as clinicians and a perioperative nurse myself, we take for granted, that people know that, simply, making sure that their home is set up ready to come home from surgery, making sure that they've got those support systems in place. It's that preoperative education that will hold them in good stead for postoperative outcomes.
Yeah, brilliant. Thank you. Haven't seen any more questions pop up just yet. Courtney, did you have anything else you wanted to add?
Probably just in terms of the clinical assessment. So we're looking at our joint health score, which is a fantastic tool for individuals to see where their joint health is at. But this is also fantastic for industry partners or partners within this Project Mobilise to really get a capture of where their cohort of members are. So in terms of predicting surgical intervention and hopefully deferring and delaying, or managing that upstream as well. So within that, we're also looking at some really clinically validated tools like your COOs or your WHOs, and then your Promise 29, and also those vital captures and that ROM capture as well. So we're really profiling the patient, and in those 6 weeks, what can we do to move that needle? And a lot of it has been implementing a pretty brief but stringent physiotherapy prescribed specifically for that patient to really shift that behavioural change in that 6 weeks. So that clinical data point, a lot of people don't have that visibility, and what we're providing them is that patient-generated data and how we improve in that over that period. So yeah, it's fantastic to see the results, and patients are really encouraged by their progress as well.
Yeah, and it's more convenient, at the end of the day too.
Absolutely.
Less drives to the clinic and less sitting around in waiting rooms. Yeah,
absolutely. And that behavioural change, this has to be a daily thing, not every 2 weeks when I go to the physio, I'll do it. So we try and make it really achievable and have it as a daily lifestyle change that they implement from then on in. Yeah.
So look, I'm conscious of time, so I might just sort of wrap things up, Courtney, if that's okay. I think the key discussion points here, we just wanted to reiterate, and again, this has come out of all the conversations we've had in the last 2 weeks, is just understanding what your point of entry would be when it comes to participants, whether it's a hospital organization or an insurance fund, or it's an industry body or a not-for-profit, or whatever it might be. What does that point of entry look like? We can support you with a welcome pack around that. Understanding your resource allocation. Can someone be the champion internally that we can connect with, and how many patients can be allocated? Understanding what you want to measure and what does long-term success look like, and then just understanding, again, because Beyond the Clinic is funding this pilot, can you commit to the timelines that we're putting forward as well? Please scan the QR code or jump on the website is beyondtheclinic.io/mobilise, hopefully easy to remember. And you can just enter an EOI very quickly. It takes 2 minutes. We'll book some time with you and we'll have a discussion and dive deeper if, no obligation, if we can work together and partner on this pilot. So thank you. Thanks everyone for joining. Thank you, Courtney. Appreciate all your insights there. Very helpful.
Look forward to
we have recorded this, so we will share this with everyone that's registered as well. And feel free to reach out if you've got any other questions on our website as well. Thank you for joining.
Thank you.